Good morning, all of you. This side Vaishali. I really welcome all of you on my YouTube channel. ये ऑस्की लिटरली इस ऑस्की ने मेरी लाइफ चेंज कर दी. मैंने कभी सोचा भी नहीं था कि ज़िंदगी में एक ऐसा टर्न आ जाएगा जहाँ पर ये ऑस्की का एग्ज़ाम लिटरली मेरी लाइफ चेंज कर देगा. सो गाइस, मैं आज आप लोगों को बताने वाली हूँ कुछ बहुत इंपॉर्टेंट पॉइंट्स जिसकी मदद से आप अपने ऑस्की एग्ज़ाम को पास कर सकते हैं. जिन पॉइंट्स को मैंने मद्देनज़र रखा मेरे एग्ज़ाम के दौरान, और उन्हीं पॉइंट्स को ध्यान में रखकर बहुत सारे बच्चे अपना ऑस्की का एग्ज़ाम in their first attempt they are passing. So without wasting any time, let's start the video. First of all, let me tell you OSCE is valid in two countries. The number one country is New Zealand and the number two country is particularly Australia. मैंने यहाँ पे यूके या किसी और कंट्री का नाम क्यों नहीं लिया, बिकॉज वो ऑस्कीज की प्रिपरेशन ऑलरेडी एजेंसीज और जहाँ पे भी जिस भी कंट्री में आप जा रहे हो वो लोग उसमें पार्टिसिपेट करते हैं. लेकिन ऑस्ट्रेलिया में अगर आप ऑस्की दे रहे हैं तो इसमें जो एग्जामिनेशन सेंटर है उसका कोई योगदान नहीं होता है. आपको अपने बलबूते पे इस ऑस्की को पास करना होता है. नंबर टू, और न्यूजीलैंड की मैं बात करूं तो न्यूजीलैंड में भी आपके 1 से 2 ही दिन ओरिएंटेशन क्लासेस होती हैं. उसके अलावा उनका आपके ऑस्की एग्ज़ाम के साथ किसी प्रकार का कोई योगदान नहीं होता है. इसीलिए आपके ये जो ऑस्की के एग्ज़ाम्स हैं ये बहुत 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 डिफ़िकल्ट तो नहीं मैं बोलूँगी, बट बहुत इम्पॉर्टेंट है इनको पास करना और इनके बेसिक्स को समझना कि ये आपसे डिमांड क्या कर रहे हैं. ऑस्की एग्ज़ामिनेशन में आपसे क्या चीज़ों की उम्मीद रखी जाती है और किन बेसिस पे आपको ऑस्की एग्ज़ाम के लिए पास किया जाता है. सो लेट्स स्टार्ट द वीडियो विदाउट वेस्टिंग एनी टाइम. सो गाइस, आप देख सकते हैं यहाँ पर आपकी स्क्रीन पे न्यूजीलैंड नर्सिंग ऑस्की मार्किंग चेकलिस्ट पास और फेल गाइड. तो आप देख सकते हैं ये जो चेकलिस्ट है वो मैं आपको इस ऑस्की के बेसिस पे बताने जा रही हूँ कि क्या आप चीज़ें आपको ध्यान में रखनी है, एंड आई विल एक्सप्लेन ईच एंड एवरीथिंग सो दैट मे बी इट रियली गोना हेल्प यू टू पास योर एग्जाम. So the first and first most thing is safety and infection control. We have a lot of stations which particularly focus on safety and precautions. For example, आपका यूरोनालिसिस. यूरोनालिसिस एक ऐसा स्टेशन है जहाँ पर लिटरली क्रॉस इन्फेक्शन की स्किल्स आपके जज किए जाते हैं. द नंबर टू, वी हैव वूंड ड्रेसिंग. दे आर गोइंग टू गिव यू वन डमी and there will be wound, and you have to clean that wound by using aseptic non-touch techniques. So in that station particularly they are looking your infection control skills. So now what are the interventions that you can implement over there? The number one, hand hygiene. So let me show you how you need to do it. So you need to do like this: the first step, the second step, the third step, the fourth step, the fifth step, and then that's all. You can also go for interlacing, but it depends on you. Okay, so quickly we are going to do it. All right, hello, my name is Vishali. I'm a registered nurse. How are you? Or you can also add one more step, this one, and then the same thing. Don't do like this, please. Okay, so you have to do like and this. So make sure you have to perform hand hygiene before and after the procedure. So if you are documenting, but immediately you just shift it to documentation without doing the hand hygiene, marks will be deducted. So please make sure, make this habit. This should be in your like blood, it should be in your nerves, okay? So always, whenever you're introducing, hi, my name is Vishali, I'm a sister nurse looking after you. How are you? So you have to do it collectively. Now, so next we have use appropriate PPE. Ideally, we don't have any station in which you have to follow the PPE, okay, but still, sometime in urinalysis, they might put some goggles, the gown, but in other stations, you will not get this thing, so don't worry about this. Maintain aseptic technique. See, I told you already, aseptic non-touch techniques, wound dressing station. So, hand hygiene, always. Dispose of waste and sharp safely. तो गाइस, ये सेफ्टी में आ जाता है कि आप अपनी कितनी सेफ्टी रख रहे हो और पेशेंट की सेफ्टी को कैसे मेंटेन कर रहे हो. इफ यू सी द पेशेंट इज सिटिंग एट द एज ऑफ द बेड, you need to tell him, This is not about the station, this is about the safety. If you see the patient who's sitting at the edge of the bed, you have to tell him, well, your safety is my priority, please can you lie down for me, because you might get a fall. So guys, safety is not about your performance, it's about, naturally it should be in your blood, that if you see something unusual, your mind automatically should click like, patient is not safe, I need to make him safe. So, guys, this skill is not learned in 1 or 2 days. This skill is particularly learned like with a very good practice, very, very good practice. So, the freshers who have not worked anywhere, they might face some issues with this because they can learn the data, they can learn the script, but this is not the script, this is the natural habit. So that is something, that makes students get failed, because this is the reason behind it. So please make sure safety precautions and your preventive protocols, be aware of it. Next, patient identification and consent. So, guys, you cannot disclose patient's ID in front of anyone. You have to make sure that I am with the right patient. So, I just need to make sure I'm with the right patient. So, can you please confirm your name to me? Check the ID. In ID, we have three parameters: name, date of birth, NIC number, NHI number or MRN number, and also allergies. So these are the 4 points for your patient identification. Introduce self, name and role, confirm the patient name and date of birth, explain the procedure clearly, obtain the verbal consent. Is that okay to you if I do your vitals, if I check your vital signs? Yeah, that's okay to me. Move on. And one more thing, in New Zealand OSCI, the confidentiality is very, very, very important. So if you see two people, one is patient, one is relative, please make sure you take consent first from the patient, that is that okay if I share your details in front of your relative? Is that okay to you? Yeah, that's okay to me. Now you can proceed. So make sure patient identification is also one of the very important point. Next, communication and professionalism. So, guys, this is particularly whatever you're talking. Hi, my name is Vishali. I'm a register nurse looking after you. How are you? You good? That's really great. I'm happy to hear that. So, well, the reason why I'm here, I'm going to check your vital signs. I hope that's okay to you. But before that, I really need to check your ID. So, just give me a second. Let me go and grab your file. Okay, so can you please confirm your name to me, your date of birth to me? All right, so that is particularly your communications and your professionalism, that you are standing over there with full sincerity, with smile on your face, with a positive energy, all that, it's very, very, very important. Very, very, very important. So communications and professionalism. Used clear and calm and respectful communication provided reassurance to the patient, maintain patient dignity and privacy, verbalized actions clearly. So you need to maintain all that stuff. So be aware of it. Clinical skills and knowledge. Again, I'm telling you, a fresher can pass the exam on the basis of theory and the learning skills, but the clinical skills and the knowledge is particularly, you have to use your NCLEX data, your CBT data. So you have to show them that yes, you are knowledgeable. I'm doing this because this might prevent this. That is, so nobody, not even a single student will going to say them like it will help you to do this to prevent you from this. So that's why it's very important. Nobody gonna explain it. Student will come, they'll perform their task and they'll go. But only and only knowledgeable people and your clinical skilled person will stand over there, will explain each and everything, and will satisfy the patient. That is the reason why I'm doing this. I hope that is okay to you. And then they will proceed. So there is a big difference. So guys, please make sure clinical skills and knowledge plays a crucial role. So follow the correct clinical steps, use equipments correctly, recognize the abnormal findings, and apply the clinical judgment appropriately. That's why I always mention, if you see the BP is normal, still tell them. In case if you feel dizzy or headache, please just let me know. These are the red flags. Saturation is good, but still you have to mention. Still, if you feel dizzy, if you feel shortness of breath or you have difficulty in breathing, please just let me know. So these things are very, very, very important. Next, acceleration and patient deterioration. I still remember we are we have deteriorating stations in which we need to accelerate the finding to a higher authority like doctors and all. So in that condition, if you're calling the doctor but you are not telling him why you have called, there is no logic. You have to tell him what was the thing, that's why you called him, the deteriorating sign and symptoms, the deteriorating factors. So guys, make sure you have to accelerate the findings. Don't, a patient told you I have nausea and you're talking to the doctor and you're not mentioning that sign and symptom, it's mean you are not accelerating the findings. So whatever the patient tells you, tell them I will share this finding with the physician. So acceleration is very important. Then after we have medication safety, very 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 important station. It's not everyone's cup of tea. ये स्टेशन हर किसी के बस की बात नहीं होती है. ये स्टेशन बहुत ही ज़्यादा प्रैक्टिकल और स्किल्ड स्टेशन है. कुछ बच्चे तो ऑर्डर भी नहीं पढ़ पाते हैं ढंग से प्रैक्टिस करने के बावजूद भी. बट स्टिल ये प्रैक्टिस से ही आती है चीज़ें, और आपकी थोड़ी जेन्युइन नॉलेज, आपके खुद का दिमाग. बिकॉज एक टीचर आपको कितना ही सिखा सकता है. वो आपको सिखा सकता है क्या बोलना है, कैसे करना है, यही सिखा सकता है ना एक टीचर आपको. लेकिन उस टाइम पे दिमाग कितना तेज भाग रहा है, वो आपका ही दिमाग है. सो यहाँ पर ये चीज़ बहुत इंपॉर्टेंट है, आपको दिमाग लगाना आना चाहिए. नहीं आता है तो भाई प्रैक्टिस करो, आप अपने दिमाग की प्रैक्टिस कीजिए. टीचर एक लिमिट तक ही आपको पढ़ा सकता है, एक लिमिट तक ही आपको करवा सकता है. आप पर आपके दिमाग की कोई लिमिट नहीं है, आपके ब्रेन की कोई लिमिट नहीं है. यू हैव टू प्रैक्टिस. एंड गाइस दैट्स ऑल. सो प्लीज मेक श्योर आप इन सब चीज़ों को फॉलो कीजिए. अपने ऑस्की के एग्जाम को पास करने के लिए आपको इन चीज़ों को फॉलो करना ही पड़ेगा. And guys, one of the very important thing, we provide coaching for New Zealand OSCE also and Australian OSCE also, in which we provide almost 15 to 20 days online classes for New Zealand OSCE and 15 to 20 days offline. It, the cycles you can repeat, you can take again online, you can take again offline. So it depends, but 15 days are more than enough. But still, if you feel student is not fine, still student is experiencing some issues, then we can increase the days like 3 to 4 days more. But minimum are like 15 days. More than that, it depends on you. Okay. And for Australian OSCE, it takes little bit more time, like 20 to 22 days somewhere. So it depends, because in your Australian OSCE we have more stations, like a lot of stations. But in New Zealand OSCE we have limited stations, so that is a difference. But still guys, if you experiencing any issues, if you want to train yourself with us, you can definitely contact us. And just make sure you follow all these points, because these points are very 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 important to pass your OSCE exam. Thank you so much.